Hi everyone, today I am inspired by all of you and my colleague to do the video of the middle ear. Now you know our ear, such an important organ for audition, and this ear is situated within the petrous part of the temporal bone. You see, this is the temporal bone, this is the outer aspect, and in the outer aspect you will see the external auditory canal and the external auditory meatus. And you will see this external auditory meatus, when you put your bud inside the ear for cleaning the cerumen, at that time you will see sometimes the bud touches an organ that is known as the tympanic membrane, and you will get some pain and resistance. So this part is known as the external ear. Now the middle ear, you will see the middle ear is a 6-walled cavity, and this is you will see the petrous part of the temporal bone, and here you look, this is the pink colored thing I have put, that is the impression of the roof of the middle ear, which is formed by a very thin plate of the bone, the petrous part, and which is known as the tegmen tympani. So this is the tegmen tympani part of the bone, and through this it is related, you will see the middle cranial fossa is situated here near the roof. So here it is related with the dura mater, the arachnoid mater, and also it is related with the temporal lobe of the brain. So this is how the roof of the middle ear is formed. Now this is actually a 6-chambered cavity. I will make this middle ear cavity, that is it is 1/3 than this model. So this middle ear cavity has got a roof. You will see the pink color. I will show you here the pink color roof. So in this 6-wall cavity, you will look this pink color roof. You will see here. Now floor, this has got a floor which is made up of vein, that is the venous wall. It has got a lateral wall that is directed laterally and that is obscured by the tympanic membrane. And this is the medial wall of the cavity, and this medial wall is related with the so many of structure which I shall discuss later on. Now this is the anterior wall. I have made this anterior wall, you will see by the red color, and in this anterior wall, in the lower part, the artery, the internal carotid artery is related to it, and above that you will see there is 2 canal. The one canal is occupied by the pharyngotympanic tube. Again I introduce. So this is the pharyngotympanic tube, which it is connected with the nasopharynx, and it maintains the air pressure within the tympanic cavity. You know, the middle ear cavity is responsible for the augmentation of the sound, because you know the augmentation of the sound requires an ear. That's why we will see the musical instrument, the tanpura, the sitar, the harmonium, the guitar, everything has got a ear-filled cavity inside. So this middle ear cavity augments the sound which is received by our external ear. So this air pressure is maintained from this nasopharynx, that is by means of the pharyngotympanic tube. And below this blue color, this represents the canal for the tensor tympani muscle, which actually make prominence of the it make prominence in the medial side, the tympanic membrane. So this projected portion of the tympanic membrane is known as ambu. So this is the anterior wall. This is, you see, this is the posterior wall of the tympanic cavity. In this posterior wall, it is related with a air-filled area which is known as the mastoid antrum, and it is related through the additus of the mastoid antrum. So you have seen all this in the model form. Now I will make, here you will see there is the tympanic cavity. You will see it is excavated. How it is excavated? It is excavated from the mastoid process, you will see. And you will see here the mastoid air cell also, the mastoid antrum behind, and through this you will go to the medial wall of the tympanic cavity. You see, this is the mastoid process, this is the mastoid air cell, and here you will see the mastoid antrum, and here you look, this one you see the elevation, and this elevation is known as the pyramid. How this pyramid is formed? This pyramid is formed by the first turn of cochlea. You see, this is the skeleton of a snail which I have picked up for this internal ear demonstration, and you will see this is the basal turn of cochlea, and this basal turn of cochlea form an elevation here. This is known as the pyramid. So this is the boundary you will see here. Now above and below the pyramid you will see the windows, small windows. This is the oval window. It is visible to you. One is oval window, and below that there is the rounded window. In the oval window, you know, the foot plate of the stapes is attached. They are very tiny bones. I shall show you the malleus incus and stapes during the demonstration of the internal ear. So now you will see that here the temporal bone is cut. So you can locate here the part of the mastoid ear cell. You see here, this is the pneumatic type of mastoid. You will see the mastoid ear cell, and you will see we cut the region of the squamous and the junction of the petrous part. So when we remove this, you will see, you will get the tympanic cavity. This is the external ear and the external auditory meatus, you will see, and when you open this, you will see this is the middle ear cavity. This red, you will see this thing, I pass the black one, you will see this is prominent. So middle ear, I have seen you, it is located under this. So here you will see this thing, if you put in this region, this is the situation of the middle ear. So you will see this situation of the middle ear, and here you will see the beginning of the internal ear is cut, and this eminence in the bone is known as the arcuate eminence. You will see here, this is the arcuate eminence. So this arcuate eminence represents the superior semicircular canal. So here, where it is cut in such a way, the side of the arcuate eminence, you will locate, this is the superior semicircular canal is situated here. This is the position of the superior semicircular canal. So petrous part of the temporal bone not only houses the audition organ of audition, but also the vestibular system, that means the balance of our body. So you will look here, this is the balance is maintained by the semicircular canal. So you will see how small the middle ear cavity is, and within this small thing our whole of the function of the ear is situated. We are actually gift from the God that we hear such a nice musical sound, such a nice the sound of the murmur of a tree, and such a sound of the actually the sung by the different parrots and the cuckoo and all this bird sound and everything. And also we will feel the sound of the noise, sound of the noise. So in this small thing, such an important organ is situated. So you will now see how again I repeat that thing, this is the superior wall. So this is the superior wall, which is formed by a thin plate of bone known as tegmen tympani, and this tegmen tympani is related, you will see here, it is related directly with the encephalon and with the meninges. Next, the below the structure, you will see it is related here. This is the roof, the below it is related with the superior bulb of the internal jugular vein. So from the sigmoid sinus, if you see the sigmoid sinus located in this bone, so I will show you the sigmoid sinus where it is located. This is the location of the sigmoid sinus, you will see. So during the operation of the ear, middle ear, or the implantation of the cochlear implant due to sensorineuronal disability, so there is a very risk of damage of this sigmoid sinus. They are very much vulnerable to fracture during the operation. You see, it is so closely situated. You see, you go through the suprameatal triangle, you excavate near the mastoid region. So all these structures you will see, they are closely related with each other. So the ENT surgeon must be careful with this sigmoid sinus. And if there is middle ear infection, then what will happen? There may be the acute infection which is of sudden onset, and who actually bath in a pond, the villagers, and also the person who swim in the swimming pool. There is mixture of the bacteria. So they go through this mouth from the nasopharynx, it will come into the middle ear or from the external ear. So what will happen? There is repeated infection, and this repeated infection may give rise to the chronic one if it is not treated. So if it is a chronic one, so there may be the infection of the roof, that means the meningitis or encephalitis. It may also invade the floor, that is the sigmoid superior bulb of the internal jugular vein, and also produces thrombosis, and there is also the blockage of the nasopharynx, and you cannot actually heard any sound, or the sound become diminished. So this is the different problem arises from the middle ear cavity. So thank you everyone for watching this video, and suggest me about my performance by giving comment.